Okay, good morning, everybody. And once again, thank you for inviting DG Sante for this very interesting event, which actually I was happy to listen and learn a lot of information from your country. And indeed, I am the main contact point for Falsified Medicines Directive in Unit D2, Medical Products Quality, Safety, Innovation of Directorate General for Health of the European Commission. And I am also pleased to tell a few words, because I think many was said, and there was also, I heard a reference to the Commission report. So indeed, the main event in the field of FMD of the last year was the publication in early July of the Commission report on the implementation of the Falsified Medicine Directive, what was a kind of a standing obligation of the Commission to report on the performance of its legal act after 5 years after application. So in case of FMD, it was 2019-2024. And the report was supported by an underlying study, which collected also feedback from various stakeholders and member states. In a summary of the report, indeed, it was concluded that the fact that there were still 2 member states which had derogation, and the system was not yet implemented in all member states. This is something what needs to be completed in order to see the full potential of the Falsified Medicines Directive. However, what could be concluded was that it made more difficult to introduce illegal products into the legal supply chain, and basically forced illegal products to stay in illegal circuit, and it was able to generate data for investigators that make it possible to detect suspicious packages and to track falsified medicines. So these were indeed the key objectives which were achieved, at least in the member states where it was implemented. For 2025, the key milestone is indeed the application of Falsified Medicines Directive in Greece and Italy, where the legal deadline for the derogations, which were justified by the national system, which had been in place in those countries before introduction of FMD, and the legal deadline was 9 of February 2025. Greece managed to complete all the administrative steps to conclude their connection to EMVS, and indeed it will still take some time before the stock of old products is being replaced by new products, and the process is ongoing. Unfortunately, Italy was a bit later in their steps. So as far as I am still aware to the moment, there are even not connection to EMVS. So we hope that Italy does their best effort to get fully apply FMD as soon as possible. And indeed, there were also some other minor imperfections identified by the report, including high rate of products which were not properly decommissioned from the system. Still several member states with significant number of particular hospital pharmacies which were not properly connected to the system. Also still some member states accepting so-called stabilization period, where basically they are somehow let's say more generous to dispensing products which show alert at the dispensation. And indeed, I am aware that MVO and ENVO, they do their best effort to actually eliminate any false alerts. So there should be not any more valid excuse for member states not to investigate alerts from when dispensing their products. So this is indeed something decided the points where the further work needs to be done, and this is in collaboration with experts from the member states, in collaboration with MVO and ENMVOs. We are aware that EMVO has currently circulated a questionnaire to all member states to better understand the needs of the regulators and possibilities how to make system even more useful and more easy to use for the regulator. What is indeed important to encourage the regulators to use the full potential of the system. So we as the Commission will be further following these developments, and indeed there was also a reference made to the pharmaceutical review, so the revision of the regulation where the FMD is not primarily addressed, but indeed, and this was also said, it might have some indirect repercussions to the way how the system works, and we might be able to say more perhaps in 1 year time if the conference takes place again. So thank you very much for this interesting conference and meeting, and it was a pleasure to be part of it.